Hello, doctors. In this webinar, I would like to discuss the up-to-date research in nutrition of white fibrocartilage, of which includes the intervertebral disc. We're going to be discussing chondroitin sulfate and B vitamins in cartilage and metabolic health. Let's start with a new paper. Just came out in the International Journal of Molecular Science, June 2nd, 2021. And of course, the references are here, as always, for you to pull up and study further if you need. This paper is absolutely attention-getting and futuristic. Augmented chondroitin sulfate proteoglycan has therapeutic potential for intervertebral disc degeneration by stimulating the anabolic turnover of bovine nuclear pulposus cells under changes in hydrostatic pressure. Do we change hydrostatic pressure? Do we affect hysteresis and creep as we apply Cox distraction manipulation? Yes, we do. And if you look at the necessary findings during spinal manipulation, as by people like Wong, Beati, Kuo, you see that one of the findings in a patient who has immediate relief the same day from manipulation is that there is an imbibition of fluid from the cancellous vertebral bone through the end plate of the disc into the nucleus pulposus of the IVD. This can be measured today by the new system of diffusion weighted imaging, measuring fractional anistropy and apparent diffusion coefficients. That is, how well does this fluid pass through the Wallace buds of the end plate of the disc, and also even used to measure the same diffusion coefficients of nerve roots and dorsal root ganglion in compressive and non-compressive findings. To me, this is a very strong futuristic study of chiropractic, its premises, its history, its principles, and its clinical outcomes. When you apply that to this paper, studying stimulation of anabolism, that is the buildup of nuclear cells within the disc under hydrostatic pressure change, I think of our technique. This paper said the following. It said that chondroitin sulfate has therapeutic potential in treating intervertebral disc degeneration. The question is, can chondroitin sulfate and hyaluronate enhance the anabolism of nuclear cells? It was found in this paper that nucleus pulposus cells exposed to changes in hydrostatic pressure and osmotic pressure within the intervertebral disc found that such chondroitin sulfate proteoglycans in the presence of hyaluronic acid was significantly upregulated, and the aggregate expression of chondroitin sulfate proteoglycans under hydrostatic pressure was significantly higher than the control with hyaluronic acid under hydrostatic pressure at 12 days. So the addition of chondroitin sulfate proteoglycan had anabolic and antifibrotic effects on bovine nucleus pulposus cells during the early culture period under no hydrostatic pressure. Furthermore, it showed synergy between dynamic hydrostatic pressure to increase bovine nucleus pulposus cell anabolism at later time points. Certainly, this is no final definitive study on disc regeneration, but it is driving towards what is the effect of stopping degeneration and instituting regeneration. Now, what about this paper? This paper came out August 1. You may not have even gotten this paper yet, because I do get these ahead of print. This is in volume 4615 of Spine Journal. It's called an injectable hyaluronic acid hydrogel promotes intervertebral disc repair in a rabbit model. So injectable hyaluronic acid, when we talk about glycosaminoglycan, and we talk about that formula, well, what is it? Well, it's four things. It's chondroitin 4-sulfate, chondroitin 6-sulfate, hyaluronic acid, and carotene sulfate. That is the chemical within the nucleus of the disc that has the ability to imbibe fluid to 9 times its own volume, thus giving the disc the property of a hydrostatic pressure and osmotic force that attracts fluids through the end plate from the cancellous vertebral bone into the nucleus pulposus of the disc. This paper studied in a rabbit model that in the hyaluronic acid hydrogel group, the disc height was increased at weeks 4 and 8. A slight increase in T2 intensity, but significantly in T1 mapping was observed in those rabbits given the hyaluronic acid hydrogel group at 8 weeks. So they observed a homogeneous nucleus pulposus distribution, organized annulus fibrosis lamellae at week 8, and a slight reduced innervation score in the treatment group. The conclusion was that an injectable hyaluronic acid hydrogel had the protective effect of suppressing the loss of disc height, promoting tissue hydration for structure repair, and attenuating inflammation and innervation to prevent further disc degeneration. You notice something said there? Attenuating inflammation. What is that inflammation? Well, it's what you and I call high intensity zones within the intervertebral disc. It is the presence of cytokines. Which ones? Interleukin 6, interleukin 1b, tumor necrosis factor alpha. This paper states, and it's there for your looking up for further study, that it attenuates inflammation. This is not the first paper that has said that. If you go back to the 2-volume series by Cole Goshen Taylor called The Biochemistry of the Intervertebral Disc, you see that they also mention about abbreviating or preventing future disc degeneration. Now we're even talking about promoting tissue hydration and structural repair of the disc. I hope that these new studies supplement what you already know about our work. Here is, incidentally, that 2-volume series. I suggest for excitement in life and some sleepless nights that you get these. They're the most expensive book I ever bought. They're $1 a page. You're looking at 250 pages, dollars here, but well worth the excitement. 2 volumes. I suggest that you supplement your erudite knowledge of intervertebral disc degeneration, which I'm sure you see all day, every day. Am I right? Of course. It's probably safe to say that the most common thing that you and I see is disc degeneration. It begins, it's even seen in teenagers. And it gets worse as you get older like me, okay? So when you and I are talking about distraction, you know, in didactics, at our presentations, don't we talk about hysteresis and creep? Do we not show the detente under distraction to allow imbibition of fluid? And we use different forces, anywhere 2, 4, 6, 8 pounds per lumbar segment, less in the cervical spine, in order to enhance what we just saw in this paper that we just discussed about the change in what? Intervertebral disc by stimulating anabolic turnover by changing hydrostatic pressure. I don't think one can think about the technique we use of distraction to reduce stenosis, to increase disc space height, drop intradiscal pressure, thus changing the hydrostatics of the disc, increasing foraminal area, restoring physiological range of motion to create afferentation via lateral spinal thalamic tract rostral transmission to the post-central gyrus in the pyramidal system to stimulate normal excitatory reflexes, stimulate the output of serotonin and endorphins to reduce pain. I've never made it a secret. I've used chondroitin sulfate since 1966. When I first read that 2-volume book, these books, incidentally, were published in 1966. Most of these men, I believe, have deceased, but there are new researchers have taken up their work, and I have their published works, if you're interested, on regeneration of discs with chondroitin sulfate. So this is an ongoing, it takes decades for us to learn. All we do is we take our clinical experience. I did that with this. I made this formula back in 1966 after I studied that textbook. I got it from a green lip mussel, Pernicatelliculus, grown on cables grown in the ocean in New Zealand. That is the highest source of chondroitin sulfate known on Earth. We put it in this called Discan Enhanced. This is probably the 7th or 8th time that we have changed the formula to improve it with new findings. This has, it is Pernicatelliculus. It has the 5 minerals found in the intervertebral disc, all attached to the sulfate radical. And this is sulfate radical within the disc that sets up the Donan equilibrium to attract the proteoglycan into the nucleus of the disc. So these are papers that I just got. I wanted to share them with you. If I could take just a few more minutes. How about this paper out of Medical Archives in December 2019 in a review of degenerative intervertebral disc disease? No paper like this can escape a chiropractor's attention, right? I'm sure you've all seen these, but allow me to just share with you. The main factor in degeneration of the disc is the loss of the proteoglycan. What are those proteoglycans? We just listed them: chondroitin, hyaluronic acid, and carotene sulfate. Disc nutrition to retard disc degeneration, hopefully to stimulate disc regeneration. Impaired nutrition leads to disc degeneration. Disc nutrients can reach a low substance in which it results in apoptosis or selective cell death. Pierce wrote that low proteoglycan concentrations in all the discs of the spine precede degeneration of the disc. Poor nutritional supply has a long-term effect on disc degeneration. And when you think about it, and disc degeneration not being a disease of older people from 50 on, it's actually a disease that starts in the teenage years of life. Should these people be doing proper stimulation of hydrostatic pressure? Should they be taking chondroitin sulfate, Pernicatelliculus, in order to prevent not only degeneration of the white fibrocartilage, the intervertebral disc, but what about the menisci of the knee? Schlecht wrote that biochemical alterations in lumbar disc are present before the appearance of the morphological changes. In other words, the loss of the glycosaminoglycan plays a central role. Long before we ever see the degenerative change, there is a marked loss of glycosaminoglycan within both the nucleus and the annulus of the disc. The Russians are big on this. Here's a paper published in 2019. This is the name of the Russian journal. These are Index Medicus, National Library of Medicine, PubMed. These are all peer-reviewed journals. And they call these chondroprotectors. You can read this paper. They actually use chondroitin sulfate as a preventer of disc degeneration. Glycosaminoglycan in the nucleus decreases as disc degeneration increases. Here is the famous work on disc degeneration of Fearman. Remember the 5 classifications? Normal, grade 1, 2, 3, 4, disc degeneration. By the time we get here, the glycosaminoglycan is really erased. I figure we want to be ideally here, but methodologically imperative that we be involved with our manipulation, our distractive hydrostatic stimulation, and giving the people chondroitin sulfate via the green lip muscle, perna canaliculus, giving them turmeric, which is curcumin, coupled with Boswellia serrata, devil's claw, white willow bark, and quercetin to control the inflammatory changes that are so active when we go from B to C to D and finally burn out here. Quercetin. This is formula 1. These are the B vitamins. They contain B6, 9, 11, and 12 in order to convert homocysteine into methionine. We use those 3 formulas whenever we're treating discs that look like this. And incidentally, the Fearman classification, if you're not familiar with that, so on page 130 of this textbook, this is the text I wrote. I don't get any of the money. I give all the money to research. Incidentally, we will be at the Kaiser University College of Chiropractic Medicine on August the 20th for a day of studying with the new ultrasound unit, the P9 ultrasound of GE. We'll be studying the distractive changes when we apply distraction Cox manipulation to these intervertebral discs. We will note the interspinous space increase. Futuristically, we will use that to implement disc space height and foraminal increase as well. But we are studying now the various forces applied to these degenerative changes so that you and I can know clinically what are the interspinous increases according to various degrees of disc degeneration. And incidentally, very futuristically, what are the changes when we implement nutritional stimulation to these grade 3 and 4 intervertebral disc degenerations, even grade 5.
It'll be a great day because the Haven table will be there too, the Cox 8 force table.
Right.
And we get to watch the forces, so we'll know the forces as well as whatever you see, you can put them together. So
yeah, that day, August 20, we will have Dr. Ralph Cruz, lead clinician at Kaiser University, Dr. Wiles, the president of the school, the representative from the General Electric Ultrasound, Dr. Brett White, who's a clinician and instructor there. I have the pleasure of being there. Dr. Kurt Olding will be there. Dr. Ram Gudavali, who heads our research, and the people who make the Cox instrument, Don Wisner and Terry, his engineer, who take these ideas, these research ideas that they will witness that day to implement that new research into the instrument for performing spine manipulation. I must rest there for a moment. If we go on here, these are all papers you can look up, doctor. What about the work of HIA, the Journal of Orthopedic Research? 28 days of compressing a disc in the rabbit model degenerated it. 28 days of distracting it. What happened? Regeneration of the matrix in both the end plate and recovery of the vascular channels into the disc. What do you and I do? We do what the osteopath said. 3 words. We stretch tissues. And you know, that doesn't matter whether it's a spine, a shoulder, a knee, any appendicular or axial joint. When we distract, we change hydrostatic pressures, we stimulate circulation. Hopefully, we regenerate white fibrocartilage. Here's Yao, published this in Aging Research. Can I ask you, have you noticed the new term, aging, within people? This paper points out to retard or reverse disc degeneration. The abnormal conditions of decreased viable cell population and the altered cell phenotype should be corrected. A very early intervention is indicated by the finding that the onset of human disc degeneration occurs as early as what? Adolescence. Yes. As opposed to no exercise, obesity, eating at McDonald's, no interest in nutrition, certainly no interest in distracted changes in hydrostatic pressure of the disc. We developed what? Discal degeneration and all of the clinical conditions that brings these people to the chiropractic doctor's office. We're going to have to look at treating young people, adolescents, for the treatment to prevent what? Discal degeneration. Spine Journal in 2020 wrote this: degenerated discs exhibit greater reconstruction after low tension traction. Do you get that? You remember the paper by Isner Horbati? What did he say? He said that 10% of traction force gives better long-term clinical outcomes than 50% of body weight. Here's another paper by Guo and his group out of Spine Journal, September last year, not even a year ago, that said degenerated discs exhibit greater reconstruction after low tension traction. Doctor, that's what we do. We teach you what 2 pounds of distraction force feels like compared to 4, 6, and 8. And we also say what? What do we say in didactics? We say use the lowest force that gives good distraction and comfort to the patient. You never hurt a patient at low tension. You can always add to, but you can't always take away from the distractive force. I think that this is a beautiful paper. Says it is clear that the intervertebral disc mechanical microenvironment depends to a great extent on low tension traction as opposed to high tension traction. Doctor, in our work, I don't know how many are certified people. It's less than 1 or 2% of all the chiropractors. And yet, the National Board of Chiropractic Examiners say that what, 67% of chiropractors say they use Cox distraction manipulation. No. Unless you know what 2, 4, 6, 8 pounds feels like, unless you've been on a force table and watch the distractive forces that you are applying. And if you've not seen the ultrasonic studies of interspinous space increase with this technique, you're not, in my opinion, prepared to apply it in clinical practice. I remember the last seminar I did. This great big rugby player came in and he's angry at me. He said, your technique hurt my back. I said, well, I'm sorry. He said, yeah, my friend did it to me. And I, in all humility, I said, doctor, might I treat you? Would you allow me that honor? Well, okay, he said. So I treated him. When we got done, he said, that was nothing like what the other doctor did to me. I said, isn't it amazing what happens when you do the right thing and get the right results? You do the wrong thing and you get the wrong result, you get what you got. Today, that doctor is one of the biggest users of Cox technique that I know of.
Very enthusiastic.
Very enthusiastic, man. I mean, I go as far as say, if you're not certified, don't use the work.
I'll chime in here too. It's the importance of doing a hands-on in-person class, because I know it's COVID time and all, nobody wants to do hands-on classes. but they want certified online. We can't certify online. You have to come and really do the hands-on.
Yeah. Absolutely. And see, what do you think of that paper, my colleague? I mean, when you read this paper out of Spine Journal, that's the NAS, North American Spine Society Journal. What did you feel like when you read that title that said stable mechanical environments created by a low tension traction device is beneficial for the regeneration and repair of degenerated intervertebral discs? Did that catch your attention? Or did you just go golfing? No, this catches your attention. Spine Journal again, intradiscal injection of discogenic cells may be a viable treatment for human degenerative disc disease. Here's another Russian paper, 30 patients out of this journal with low back pain, mean age 51, are given chondroitin sulfate. In Russia, it's called a drug, Strectum. In Australia, it's called arteperone. They're called drugs there. 73% of the people taking it showed pain relief and improved spine function. It is now included in the treatment of low back pain as a chondroprotective drug. What's that mean? It means to stop spinal osteochondrosis. That's a big fancy name for what? Disc degeneration. All over the world, this is going on and is growing in our country. Here's Mazzuro. Another Russian journal came out in 2004. Chondroitin sulfate, a drug called Structum, highly effective in treating low back pain. I'd like you to notice something else they said, which I present to you in reference from our country. Here's what they said. 25 patients with low back pain and coronary artery disease and hypertension were placed on chondroitin sulfate for 6 months. At the end, 71% of the patients had low back relief, increased spinal mobility, and increased exercise tolerance. Hypertension was noticeably reduced, but not coronary artery disease. Well, when you use this formula, Julie and I have prepared this flyer. Give it to the patient. It has 82 references from the literature on what this is and what it can do for their health. Give it to the patient when you give them Discat Enhanced. It even points out by reference the 40% drop in colorectal cancer, the 40% drop in lung carcinoma, all referenced for you. But what about this paper? Not to use this for low back pain seems kind of silly to me. This same people in the Georgia Medical News, a combination of NSAIDs with Structum could achieve rapid rehab of patients with locomotor activity, improve quality of life in general for non-specific low back pain. Well, for years, we have used these formulas and perfected them. Now 7 or 8 new formulations. Another paper, a new treatment for osteoarthritis. Structum is an effective drug against osteoarthritis, reduces pain, improves joint function, well tolerated, allows to diminish the dose of anti-inflammatory drugs. The response persists for 3 months after stopping treatment. This is the study I just shared with you from the International Society, the study of the lumbar spine. Beagle dogs treated with glycosaminoglycan show less degenerative findings, disc space loss, the finding of osteophytic degeneration, and better repair of disc injury. Now, I could go on, and I'm willing to give you all of my research. All of these things are yours. Using chondroitin sulfate in treating. Realize this, my colleague. We talk about hydrostatics of the disc, right? All right. 70% of all the imbibition of glucose and oxygen is through the end plates. These are called Wallace buds within the end plate. When you move, when you distract, and we change hydrostatic pressure, we stimulate imbibition of fluid, carrying the nutrients into the disc. 30% of the imbibition of fluid comes through the anterior and the posterior disc spaces. So exercise, Cox distraction manipulation as we open and close the intervertebral disc space, stimulating circulation and increasing hydrostatic pressure, decreasing it, called hysteresis. If you look at this little chart taken here, you'll note that when we look at this, here's nucleus pulposus here, and it shows you with all of the fluid within it, annular fibers, intervertebral disc, end plate, nucleus pulposus center. The nutrition, the input of metabolites is necessary of oxygen, glucose to carry away lactic acid in order to maintain the health of an intervertebral disc. So you can go through all of these journals. I think I've gone on long enough to at least perk you up to read this literature, you know. The functions of proteoglycan sulfate in the central nervous system, filled with jewels, diamonds like this. Chondroitin sulfate in the central nerve can be categorized as a regulation of cell adhesion and migration, neurite formation, formation of dendrites, polarization of neurons, synaptic plasticity, survival of neurons. Chondroitin sulfate, using dermatine sulfate, C&E types exist. So when we talk about injections, all of these papers show that when you and I use chondroitin sulfate, we are repairing degraded bone. We have increased the absorption and replacement of calcium. We rebuild damaged bone, cartilage, tendon, ligament, and disc. Now we are seeing pain relief as well as anti-inflammatory benefits of Discat, chondroitin sulfate. Please read the following relief. Tactile allodynia in the mouse model when oral chondroitin sulfate is given. When you and I study nutrition of the disc, we know that we must use chondroitin sulfate Discat enhanced. We must use the formula of vitamin B, which is all vitamins, but mainly 6, 9, 11, and 12. Folate, methylcobalamin, pyridoxine. This is what I take every day. This is my daily schedule. These are my daily things. Sometimes I take glutathione as well. But I hope that this little introduction would cause you to say to Julie, would you send me all those slides? Because I want to spend the night studying nutrition of the disc, if for no one else but myself and my loved ones. Thanks for studying with me.